Hi guys, welcome back to my channel. Thank you very much for clicking on this video. As you guys would have seen by the title, today we're going to be talking all things physical therapy or physiotherapy versus occupational therapy. Just a disclaimer, I am not an occupational therapist, so if there is anything that I mentioned that is incorrect, please, any occupational therapist, if you're watching the video, leave a comment below and kindly correct me, because everything that is going to be mentioned in today's video is based solely on my personal experience, having worked with occupational therapists, and also some research that I did. If you guys didn't know, I am a qualified physical therapist or physiotherapist, if you will. They are used interchangeably, so whichever one you want to use, and I might also use both terms in this video, so just know if I say physical therapy or physiotherapy, it's the same thing. But I am currently not practicing as a physical therapist at the moment. I did practice for 2 years, and then after 2 years I just decided to take a break, but that is a story for another day. I do have my notes with me in my book, so I will be looking down every so often just to make sure that I don't miss anything. But yeah, let's get right into it. First things first, there are definitely similarities as well as differences between physical therapy and occupational therapy. However, the main focus in both professions is to restore function and to remove barriers that prevent function from being optimum. In basic terms, what we do as physical therapists and occupational therapists is to improve the patient's function, making sure that we get the patient as independent as possible. We also focus on creating adaptive strategies that will help improve that independency in patients. Treating patients holistically is the most important part, and making sure that the rehab treatment that we use for the patient is meaningful for the patient, because at the end of the day, what is meaningful for me, my goal, is not the same as the next person. So we make sure that whatever we do, whatever we work on, is meaningful for the patient. Second similarity is that both PT and OT are rehab professionals and they work in similar settings. I think with an exception of sports therapy, because I have never personally heard of an occupational therapist who works with sports teams or sports people. So I might be wrong, but I personally haven't heard. So if there is any occupational therapist out there who knows anything with regards to OT working with sports injuries and sports rehab, then please leave the comment down below. But I think that's the one difference between the settings, the area of working that physio and OT can do. And then the last similarity is the education. In my experience, especially in South Africa, both OT and physiotherapist, OT and PT, needs to study for 4 years to get your bachelor's degree and be able to practice as a professional OT or PT. However, in both cases, you need to do your community service, 1 year community service after you graduate. That is in South Africa though. On to the differences. The first one we're going to start with is salary. According to my research, OT salaries ranges from 30k to 48k. I'm not sure how true that is, but that is what was shown on the internet, while the average PT salary ranges from 29 to 87k thousand rands in rands. However, I can tell you now as a physical therapist that you can definitely earn less than 29k, especially if you are starting off. Your salary is gonna definitely be less than 29,000 rands. So just be prepared for that. You can earn more as well, so it's just also dependent on where you work. But definitely as a community service physical therapist, you're gonna be earning less than 29,000. And then after that, when you get to choose where you want to work, maybe you can earn more or still be earning less. So it really just depends on where you work, how many hours you work. It really depends on many factors. PT focuses on mobility and stability, which involves or includes the whole body, and things like balance, gross motor functioning, walking, strengthening, maintaining range of motion, while occupational therapists will focus on fine motor skills and cognitive functioning. But it's not only limited to that, they also look at the patient's occupation and ADLs, which is activity of daily living, and ADLs, to make sure that the patient, as mentioned before, is as independent as possible. So the ADLs might include getting up in the morning, how the patient gets up, making a meal in the morning, how they are able to prepare their own meal, eating that meal, how do they eat, do they have the capacity to bring the spoon to their mouth, do they have the capacity to coordinate the action to actually try and bring the spoon to their mouth, do they have the cognitive skill, the cognitive ability to think of the function that they're trying to do, and they look at what is lacking and they try to work on improving that. While PT work on strength, like I mentioned, does the patient have enough strength in their muscles that is required to bring the hand to the mouth? Do they have enough range in the joint as well to allow that elbow to bend fully so that the spoon can come to the mouth? So we work on improving that. If the range is the problem, we work on improving the range. If the muscles is the problem, we work on improving the muscles. If the coordination to actually try and bring the hand to the mouth is a problem, we work on improving the coordination. Also with OT, there was a video I was watching while I was doing my research, and that person mentioned something really important, and she said that OT uses a biopsychosocial approach to rehab. Basically what this means is that if you can't adapt the individual to the environment, then you need to adapt the environment to the individual. If you have a patient who had a stroke, maybe after rehab they can walk, but they still can't use their arm fully into shoulder flexion, or to reach up, rather, in simple term, to reach up to take a cup from the cupboard, then what you would do is that, what OTs would do is that they would go home, see, okay, this is what the patient can do, this is what the patient is struggling with. So suggestion will be, bring all your utensils, your cups, your plates down to the bottom where you can easily reach, because now you don't have the capacity in your arm anymore to bring your hand up. So now we're changing your environment instead of changing you, because we tried to rehab you and to change the difficulties, and this is how far we've gotten. So now let's look at the environment and change the environment by moving the things from the top shelf to the bottom shelf where you can easily reach and still be as independent as possible. While PT work on strength, like I mentioned, does the patient have enough strength in their muscles that is required to bring the hand to the mouth? Do they have enough range in the joint as well to allow that elbow to bend fully so that the spoon can come to the mouth? So we work on improving that. If the range is the problem, we work on improving the range. If the muscles is the problem, we work on improving the muscles. If the coordination to actually try and bring the hand to the mouth is a problem, we work on improving the coordination. Alright guys, that's it for today's video. I hope you guys enjoyed the video and that it was informative. If there's anything that I didn't talk about that you guys are wondering about or you have a question about, please do leave it down below in the comment section and I will try to answer it. And also, like I said before, if there are any occupational therapists out there and there is a question for occupational therapy, please do answer and let's help each other out, because I'm not perfect, my research might be wrong, but I try to help and inform people as much as possible. When it comes to deciding whether you want PT or OT, I think that's a very personal decision that one can make. Just look at which one fits more with your personality and go with that, because at the end of the day, they are both rehab professions. They both work with patients and people who are sick, just in different ways. And also just remember that OTs and PTs do work together. Don't forget to like, comment, subscribe to the channel, and I'll see you guys in my next video.